This is the overview of my lecture. So, why nutrition is important in pregnancy, common nutrition problems in Sri Lanka, and regarding maternal weight gain, where should we start, and healthy eating in pregnancy, and regarding supplements, and common problems in pregnancy, special focused on gestational diabetes mellitus. So, why nutrition is important in pregnancy: development and growth of the fetus, and protection of mother's health, and preparation of mother for breastfeeding and to go through the healthy pregnancy. So we all know the pregnancy is a physiological state, but still there are some physiological changes happening, so that to combat with them we have to have a sound nutrition. So, and also future health of mankind depends on the nutritional foundation laid in the prenatal life. So, these are some of the common nutritional problems in Sri Lanka during the pregnancy: the underweight, overweight, short stature. So you can see the percentages are about like around 15 to 20, so it's significant. And both underweight and high BMI are common problems in pregnancy in Sri Lanka. So, and as well as they are directly related to the birth weight of the newborn, so that you can see the low birth weight rate is maintaining stagnated like 16%, and also stunting, stunting is stagnated throughout, so that all these are affected by the nutrition foundation laid during the pregnancy time. So, and as well as anemia is a common problem. So although it is the percentages are declining, so anemia is a common problem which is directly related to the nutrition of the mother. So, and matter, and also we all know that first 1,000 days of an infant, that is from the conceptions to the second birthday, at the end of the second year, is the main period where the brain growth occurs. Like 80%, 70 to 80% of brain growth occurs during these first 1,000 days. So that so the pregnancy comes within this first 1,000 days, so that so we have to start good nutritional backup from the day of conception. I would say even before the conception. So maternal weight gain is a crucial factor when we consider the nutrition. So it is so need for health of the baby and mother. It directly affects the health of the baby and the mother, and it is one of the best predictors of birth weight of the baby, and nutrition is one of the key factor in it. So factors that influence maternal weight gain: so pre-pregnancy weight and BMI, and also nutrition during pregnancy, what the calories we have taken, then physical activity and rest, and then mental rest received during pregnancy, then maternal infections and other medical conditions, and quality of antenatal care, toxins, if the mother is smoking, so it affects the maternal weight gain. So that there are several factors, modifiable factors, that affect maternal weight gain, which directly affect the birth weight of the child. So this is the recommended weight gain. So in normal BMI person, so it's around 11.5 to 16 kg. So in first trimester we expect around 1.5 to 1.8 kg, and second trimester around 3 to 4 kg, third trimester around 6 kilos. So these are the components of the weight gain. You can see the baby's weight, and as well as increased blood volume, fat, then fluid, and then uterine mass, breast enlargement, and amniotic fluid, and everything. So maternal weight gain is also expected according to the pre-pregnancy BMI. So that is the important factor. So a mother with BMI less than 18.5, we expect a higher range of weight gain throughout the pregnancy, like 12.5 to 18, where the normal range was 11.5 to 16. And if the mother is overweight and obese, the weight gain expectation is much less. So so these are the complications of high maternal BMI. So the mother's complications are GDM, PIH, cardiac dysfunction, sleep apnea, and the baby's ones are these birth defects, macrosomia, and childhood asthma and childhood obesity. So then to have a good maternal weight gain and to have a good birth weight of the child and good nutrition. So as I told earlier, we have to start the nutrition preconceptional. So how do we provide right nutrition? So we have to eat better but not more. So it's a common concept that a pregnant mother should eat double for the baby. So that is wrong here. You can see when it comes to calories, when normal woman needs around 1,600 to 2,000 calories per day. Additionally, in early trimesters, she would need, if she's pregnant, additional 340 kilocalories, and in third trimester it's around 452 kilocalories. So it's not the double, it's slightly more than the normal calorie amount. Then the adequate calorie amount is very important for the energy cost of the fetus and to compensate the increment of the maternal tissue, and also maternal BMR, the metabolic rate of the body increase about 10 to 15%, so that we need to have this kind of more calories. So how do we distribute the calories? You know that when it comes to the nutrition, we have macronutrients, the carbohydrates, proteins, and lipids. So from that calories, like if we say a mother in third trimester would need around 2,000 calories, so that from that 2,000 calories, 45 to 65% should be coming from carbohydrates. So carbohydrates are very important. It's glucose for maternal brain and metabolism, and also for the fetus, and the fetal primary energy source is glucose. And then dietary fiber is needed for gut health, which are also coming from the carbohydrates that we ingest. And also pregnancy has a insulin resistant state, so that these carbohydrates should be coming from unrefined, the complex carbohydrate. That means not like, for an example, if we say white rice or kakulu rice, or if you compare it with nadu rice or parboiled rice. So if you go for these unrefined varieties like parboiled rice rather than these kakulu and all, that would be better in terms of insulin sensitivity. Then the next macronutrient is for the calories, fat. So in early pregnancy, fetus uses fatty acids supplied from mother. So later pregnancy, fetus make own fatty acids. Then LC-POFA is long chain polyunsaturated fatty acids. So these are what you call omega-6, omega-3. So they are needed for the brain growth. So, and also fats are essential for the absorption of fat-soluble vitamins like vitamin A, D, E, K. So that around 30% of calorie distribution from that increment calorie should be coming from fat. Then the next macronutrient is proteins. We all know proteins are needed to build up the material for both fetus and mother. So then we have to provide around 20% of the energy. So actually when it comes to practical point, so normally 50 kilo normal women need around 50 grams of protein per day. So in first two trimesters, the need for the pregnant woman is about 57, around 7 grams more than the normal person. And then in the third trimester, it's around 50 plus 13, like maybe 63 grams of protein. So that 13 gram much needed than a normal woman. And also there are some studies shown that higher protein intake is our keto diets and these high protein diets are not advised, and they affect the fetus and the mother detrimentally, so that these slight increment of protein is advised rather than high protein intake during the pregnancy. Then we have talked about macronutrients. Now we come to these micronutrients. Micronutrients are vitamins, essential minerals, and trace elements. So these elements, folate, iron, iodine, and zinc, are have shown that substantially increase when pregnant. So as you all know, folate supplements are recommended even before the conception. Then we give iron supplementation as a routine, and iodine, of course, we all get iodinized salt, so that we get that. Zinc, of course, we don't routinely supplement, but it is shown in researches that the need is increased. So these are the food items that are rich in these elements. As you can see, folate are rich in especially legumes, green leafy vegetables, and all. Folate is actually common, and we can get normal person can get the normal requirement, but when you're since the pregnant women, all pregnant women now on folate supplementation, there's nothing to worry. Iron, of course, yes, we supplement. Then zinc, if you take these meat and this especially animal proteins, you can get the recommended value. Then these elements, vitamin A, C, and choline, slightly increase, but underconsumed by pregnant women. These elements, vitamin A, C, and choline, and especially vitamin A in first trimester, unless there's a clear indication of deficiency, we don't supplement because it is teratogenic. Vitamin C and choline, of course, the RDA means recommended daily allowance, is increased during the pregnancy period. These ones are also RDA unchanged, but underconsumed by pregnant women. So the vitamin D, vitamin E, and calcium requirement are same, but calcium, of course, we supplement. There are some studies have shown that supplementation, most countries, calcium routinely we supplement, even though the RDA is unchanged. Other than that, a pregnant mother should be advised to include a lot of dietary fibers in her diet, especially that if you calculate around 35 grams of fiber per day. So like if you take a good amount of green leafy vegetables, fruits, and also legumes, you can get that amount. Then sufficient calorie to gain weight at the desirable rate. So I would say, like I have given you the numbers, like the calorie increment. So how to supplement it practically. So additional, how do we supplement additional 340 calories. So if that woman was taking about one teacup of rice when she was not pregnant, when she's pregnant, she can take around 1.5 cup of rice with additional protein, means like another additional 7 to 10 grams of protein. That means another extra egg, or maybe extra 30 gram of fish or chicken. Or else this the 340 additional 340 kilocalories can be supplemented with the well balanced, maybe supplement, maybe a milk serving, or a milk serving plus some cashew nuts or almonds or something, some healthy snacks. So so that we don't actually we don't need to double the intake of rice or meals. That's what I'm going to explain in this. Then variety of food from each group of each of the 6 group of every day. That means like we have to include variety of vegetables and healthy snacks like nuts, and then milk, and then fish, chicken, everything. Then sufficient amount of fluid, and avoid alcohol and smoking. That is important. Then activity, of course, Dr. Asela would discuss. Then supplements, of course, iron, folic acid, and calcium. The below things are not recommended, like as I told early. Keto diets, low carb diet, high protein diets, then energy restrictions to lose weight, and coffees, of course, not more than 2 to 3 cups. Then no alcohol. Then these are the other common diet-related problems in pregnancy. Hyperemesis. Hyperemesis, of course, practical points for mothers. We have to have good hydration, and also avoid odors of fluid, because it is actually a deep-seated anorexia sometimes. And also chilled foods are advisable, and also like crackers and dry foods, and also adding ginger. There are some ginger tablets, gummies in other countries, but we don't have. Adding ginger would be beneficial in terms of hyperemesis. Then constipation, of course, adequate fluid intake around 3 to 3 liters, and also including adequate fibers in the diet. Then heartburn, of course, avoiding spicy foods, and also avoid missing meals, those things. Then a very small note on gestational diabetes mellitus. So gestational diabetes mellitus is pre-existing or any insulin resistant in pregnancy, first detected in pregnancy. So complications are common to both parties, to mother and the fetus. So multidisciplinary care is needed. And also 80 to 90% gestational diabetes can be managed without any drugs, with medical nutrition therapy alone. And also if the hyperglycemia needed any treatment like metformin or insulin, still medical nutrition therapy and nutritional therapy is very essential in managing gestational diabetes mellitus. So these are the aims of GDM management: normoglycemia, optimal maternal weight gain, and also optimal fetal growth, and no ketosis. So when do we start medical nutrition therapy? Soon after the diagnosis. Then for actually, when you go through the today's social media and all, very low calorie, low carbs diet. So for diabetes, of course, there are several diets are indicated. So those fat diets, low carb diets, keto diets are not recommended in this pregnancy gestational diabetes management. So again, the same thing, recommended weight gain is very important to monitor within the treatment of medical nutrition therapy, GDM. And this is the calorie chart that it is actually taken according to the present weight. So the BMI is taken according to the pre-pregnancy BMI, the booking visit BMI, and then when you calculate the calorie for GDM mother, we take the present weight. So So then when you calculate the total calories, so we keep the carbohydrate around lower margin, like as I told earlier, for a normal pregnant mother we usually keep there is a range 45 to 60% of carbohydrate, but here we keep around 45%, and then supply the calories from healthy fats and proteins. So these are the general advice. So 3 meals and maybe 1 or 2 snacks are advised. So then carbohydrate percentage is keeping lower margin and including healthy fats. Then type of carbohydrate is very important. We have to go for complex carbohydrate. Then it is not advised to keep prolonged our fasting, and then plate model is a very good method to advise regarding the portion control of each nutrients, like carbohydrate this much, the fats this much, like that. Then simple sugars should to be avoided. Food containing complex carbohydrate intake is recommended. High fiber intake and lean protein, oily fish, especially fish rich in omega-3, like this kurullo, kombalao, those indigenous fish varieties are advisable. And also, when you provide protein, it is really advisable to avoid raw meat, uncooked eggs, unpasteurized milk, because the risk of bacterial infections. Then smoking and alcohol are strictly prohibited. Then overnutrition in pregnancy should be discouraged. This plate model, of course, we can really advise in practical how to serve the plate. So that is actually rather than percentages or measurement values, the plate model is really advisable for the general public. Then these are the glycemic targets that you all know. So actually mother should be advised regarding the glycemic targets. According to the guidelines, actually these tests should be done daily, and before each meal and after, at least daily basis. But in practical we can't do. Most of the mothers do not have these blood sugar meters, and also it is cumbersome to check blood sugar every time. So that what we do is with the lives of discussion of VOG also, like at least once a week or maybe more frequently, we adjust the diet and try to get these targets. These are some of the sample meal plan for GDA patients. It's calculated for normal weight, underweight, and overweight, so that you can see the portions. And so snacks, you can see healthy snacks like guava, milk, and peanuts, nuts. So we can encourage, and also samaposha and this blended cereals like samaposha, triposha. Those things also we can encourage. Okay, that's all. So we can discuss questions at the end. Thank you very much.